Well, hello and welcome to Informs' webinar, From Housing to Hunger, how data science uplifts underserved communities, where we will be discussing the role of data science in better serving underrepresented groups in America. Two Informs experts will join us today to highlight how data science is making a difference. My name is Jeff Cohen. I'm the Chief Strategy and Innovation Officer for Informs, the largest association for the data and decision sciences. Informs members support organizations and governments at all levels as they work to transform data into information and information into insights that lead to better decision-making and more impactful results. Informs' 11,000 members are comprised of diverse and robust experts in data science, analytics, operations research, and other related fields. Their work touches literally every sector and has been responsible for saving lives, saving money, and solving problems across a broad spectrum of areas, including healthcare, transportation, artificial intelligence, and so much more. Today, we're joined by two Informs members and leading experts in the use of operations research and analytics in serving underrepresented groups. Dr. Morvarid Rahmani is an associate professor of operations management at the Scheller College of Business at Georgia Tech, and Dr. Michael Johnson is a professor in the Department of Public Policy and Public Affairs at the University of Massachusetts, Boston, and interim director of the William Monroe Trotter Institute for the Study of Black Culture. Dr. Johnson, Dr. Rahmani, thank you both for making time to be with us today. Before we jump into the question and answers, it would be very interesting for our participants to hear from both of you on the important work that you're doing to benefit underrepresented communities. So with that, perhaps Dr. Rahmani, you could get us going and begin by describing some of your work.
Sure, thank you. Hello, everyone. I'm really grateful for the opportunity to talk about my ongoing research projects. Broadly speaking, my research is focused on innovation and social sustainability. My goal is to apply operations research and analytics to help organizations, whether they're nonprofit or for-profit, improve their social impact. To give you some examples, I have worked with the US Army on officers evaluation and promotion systems. I have worked with startup accelerators such as Sustainability X with a focus on environmental and social impact. And I have also worked with homeless shelters, organizations who are helping homeless individuals, such as Georgia Works and DAIA. I think given ongoing societal and technological transformations and complexity and importance of social issues, it is really critical for firms and organizations to push the boundaries of innovation beyond profit making and also consider the improvement of the livelihood of underserved populations. Some of my research projects have been focused on service delivery to underserved populations, including those who are suffering from issues such as homelessness and domestic abuse. I have worked closely with those organizations to improve their service design. I'm also working on the issue of mismatch between supply and demand when it comes to service delivery for those who are suffering from domestic abuse. We are using mobility tracking data, shelter locations, 911 calls to measure the impact of stay-at-home orders during the pandemic on the demand for domestic abuse services in different regions. Just to summarize, I think in my research, I'm trying to highlight that improving the livelihood of underserved population requires collaborations of for-profit firms with the public sector, civil society organizations, and communities. Thank you.
Fascinating and important work. Thank you. Dr. Johnson, could you talk about some of your work?
Well, good morning. Thanks. Good morning, everyone. And I appreciate you taking the time to join us this morning. My main focus is using community-engaged approaches from operations research and analytics to support better decision-making, especially involving community-focused and mission-driven nonprofits and individual community members who may not have special technical training or expertise. One of my application areas is affordable and assisted housing and community development. I'm interested in identifying candidate locations for acquisition and redevelopment of housing at risk for foreclosure, as well as selecting collections of parcels of land containing vacant and abandoned housing in order to assign alternative land uses that can improve the quality of life in economically distressed neighborhoods. I'm also interested in ways that economic development organizations and urban business districts can identify a range of activities to improve quality of life and success metrics for those activities that reflect the values of stakeholders. My other primary research area is better understanding the presence and profile of diversity, equity, and inclusion in the decision sciences, specifically in university programs and operations research and analytics, and in the research literature. Generally, I would like my research to shed light on how critical approaches to OR and analytics can change the way we think about who can lead in the problem-solving process, not just the experts, but ordinary citizens. Thank you.
Thank you, Dr. Johnson. So you both have touched on OR and analytics, but it is not lost on me that many who are watching us today may not be familiar with operations research or analytics and the complexities of data science. Can you walk us through at a higher level the process that you utilize regarding these methodologies to model and identify and implement the types of solutions to the problems that you are working on? Dr. Johnson, perhaps we could start with you.
Sure, Jeff. I think of operations research and analytics as the science of identifying decision opportunities, formulating decision problems whose solutions can enable individuals and organizations to take actions that improve quality of life, and implementing those solutions to generate meaningful change on the ground. An example of this is a project to assist a planning agency to identify candidate parcels of land with vacant and abandoned housing that could be acquired and redeveloped. I mentioned this in the introduction. One challenge with this problem is that there's much more vacant land in the city than there is money to redevelop it. Another challenge is that there are many criteria one might use to choose parcels to redevelop. Yet another is that parcels could be redeveloped into many different land uses, not just housing. Finally, different stakeholder groups have different ideas about what are the most desirable land uses. We could consider two solution approaches to this problem. A qualitative approach would identify a wide range of vacant land acquisition strategies that are linked to values of economic efficiency, strategic impact, and social equity, and choose those strategies to pursue that best align with the preferences of the decision makers. A quantitative approach could use mathematical modeling to identify a limited set of parcels to acquire and assign to one of a small number of land uses, for example, parkland, environmental remediation, future development, in order to make best use of a development budget. I hope this example is helpful.
It is, thank you. Dr. Romani, would you like to add to
that? Yes, thank you, Michael. I totally agree with everything Michael shared. Just to add to that, I can say that depending on the context and purpose of this study, when we apply operations research and analytics tools, we may use descriptive or prescriptive methods. For instance, we often use like past data to understand the extent of an issue and predict causal relationship between events. An example of that is the study of, how COVID-19 affected homelessness or domestic abuse. On the other hand, we can use mathematical modeling or experiments to prescribe the best options for improving a situation or resolving an issue. An example of that is proposing a new service design or an impact measure to a nonprofit to better serve disadvantaged communities. So just wanted to share. Thank you.
Thank you for that. Listening to you both, as we think about the types of issues that we're talking about today, ranging from housing to homelessness and hunger and climate change, can either or both of you address sort of the scale with which data science is being applied to better serve disadvantaged communities? And Dr. Romani, perhaps you'd like to start.
Sure, absolutely. We definitely see a trend in data-driven studies on issues related to homelessness and hunger, which are very important and critical issues. Just to give you some examples, my colleagues, including two of our former PhD students who are now professors in other universities, I named them Professor Priyank Arora and Professor Ken Zhang, have focused on service design of mission-driven nonprofits. They have done several studies in that domain using analytics methods. My work with Professor Lindsay Bullinger and a PhD student in public policy is focused on shelter visits and shelter locations, which we use many different data sets to basically evaluate the need for shelters in different regions. Another colleague of mine, Professor Adi Patahirama, he has been studying nutritional consequences of hunger related to the Healthy and Hunger-Free Kids Act. And they have found some interesting and counterintuitive findings that actually imposing restrictions on healthy eating in schools for kids kind of like deteriorates the nutritional quality of households' grocery purchases. And what are the reasons for that? So definitely there are many opportunities to do future studies. So one thing I can add is that while we see all of these very insightful, and these were just a very small set of examples, there are many more innovative studies. I think I see many more opportunities for use of data science work to help better serve disadvantaged communities. Just to give you an example, based on my own experience, when we worked with nonprofit organizations that serve homeless individuals, we realized that different organizations use different measures to evaluate their impact. A majority of organizations simply use output measures by counting the number of beds provided or the number of meals served in a day or a month. While these are very important, they are not really measuring the outcome of their services, which is to what extent they are helping these individuals get out of their state of homelessness and become self-sufficient. That's what directly relates to their mission. So the question is how such change of measures could be implemented and how effectively could that be communicated to donors and governmental agencies for future financial supports. As it stands now, there is a misalignment between what organizations seek to use to measure the true impact based on what their clients are experiencing and what the government and donors may perceive as measures of social impact. So I see tremendous opportunities here where analytics and data-driven decision-making can help to make a difference. And this was just one example. There are many more of such examples, and I'm sure Michael can share probably more examples based on his own experience.
Thank you. And since you teed it up for you, Dr. Johnson, any other examples that you'd like to add into that?
Yeah, thanks. There are a number of researchers who are doing really innovative work to address needs of disadvantaged communities. I'd like to share them with you. Casey Lee Moss is a professor at Northeastern University, and she's used a variety of data, analytic, and decision modeling methods to learn about the nature and extent of human trafficking in the US and worldwide. She's a pioneer in collecting data on people who have been exploited to identify social and legal interventions. Julie Ivey, a professor at North Carolina State University, has developed decision models to improve the distribution of donated food to food banks to reduce food insecurity and to increase the cost effectiveness of mammography screening and building dynamic breast cancer screening policies. Andreas Thorsen, a professor at Montana State University, has done some really innovative work to predict births at hospitals in Montana, which is a predominantly rural state, in order to improve maternal outcomes, especially for low-income women and women of color. So Morva described some of her work previously, and I'd say my work complements hers in a number of ways. In identifying vacant and abandoned housing or housing at risk of foreclosure to acquire and redevelop, my goal is to increase the supply of affordable and decent quality housing and improve the quality of life in disadvantaged communities. This could have the effect of reducing the level of homelessness. In addition, one doctoral student I've supervised used problem structuring methods to learn how homeless providers and clients understand the goals of a certain type of homeless service provided to people at severe risk. This could enable the design of services to better meet their needs.
It's interesting work, and certainly a combination of your own work and the work that you described from some of your peers is fascinating. So I guess leads me to another question, right? So the work that you've both talked about is ongoing, and we're seeing the fruits of the impact of that. But are there new emerging areas that are critically important that you're beginning to work on that our audience and the policy community ought to know about or to begin to think about? And Dr. Johnson, I'll turn to you first.
Sure, thanks. One area of critical need I see is using the experiences of residents in disadvantaged communities, along with experts and researchers to help identify, formulate, and solve challenging decision problems. One example of this is the work of Nimesh Kilamsetti, a public policy PhD graduate of University of Massachusetts, Boston, who's used problem structuring methods and decision analysis to identify the challenges that residents of slum communities, in particular cities in India, face in getting shelter and access to social and economic opportunities, and identifying a range of social interventions and performance metrics that reflect the priorities of the low-income residents themselves, which can be quite different from those that government planners or nonprofit professionals believe are in the best interest of these residents. Another current doctoral student is working with low and moderate income African-American residents in Boston to learn how they experience excessive heat, which we know is a consequence of climate change, and what planning and policy responses that reflect the priorities of these residents could balance multiple social objectives. Another area of critical need I see is the issue of diversity, equity, and inclusion in operations research and analytics. The journal Production and Operations Management is developing a special issue on this topic, and contributors have identified a wide range of subjects, including supply chains, healthcare, education, and technology, in which DEI and racial and social justice are essential for developing solutions to business and social problems that recognize the existence of structural barriers to opportunity and historical inequities in service delivery and operations. My work in this space addresses two broad questions. First, what is the nature of diversity in faculty and student enrollment and the presence of DEI and racial and social justice in curricula in university programs and OR and analytics in the US? And second, what is the profile of DEI across a range of scholarly publications? And how can DEI become a widely used element of our colleagues' research toolbox?
Thank you. Dr. Omani, anything you'd like to add to that?
Sure, yes, I would be happy. First of all, I very much agree with Michael about the importance of DEI and incorporating that into business practices. Also, I should say that another stream of my work is related to inclusive innovation, that how organizations can be more inclusive when they come up with new services, when they decide about new products to offer, how they can involve the community who are going to benefit from that from the get-go into the process. So there are definitely so much opportunity there. But going back to the basically the focus of our discussion today, which is about the issue of hunger, poverty, and homelessness, I want to kind of go back to my response to the previous questions where I talked about the issue of impact measure. I think one emerging area of critical need that I can suggest is to propose a more uniform and generic set of matrices for measuring impact for addressing issues specifically related to homelessness and poverty. And this can only be done through collaborations between academics and governmental agencies. And there are opportunities to use operations research and analytics methods to address this issue more scientifically, I would say. Let me give you a simple example here just to show that how different measures can lead to different actions. Let me talk about like poverty measures that our audience might be familiar with. So when we measure poverty, we can measure it in terms as a binary variable, whether a household income is below a poverty line or it's above a poverty line. But another way to measure that is by poverty gap. So looking at it as a continuous variable and saying that, okay, how far is a household income from the poverty line? And the goal, instead of reducing basically the number of those who are below the poverty line, can change to reducing the gap to that poverty line. So why is this difference important? It is important because when we consider poverty gap, if we really want to reduce poverty gap, our focus is going to be on improving the livelihood of the poorest of the poor, basically those who are the way far from the poverty line. Whereas if we consider the poverty rate as our measure, then our focus shifts toward helping those who are the least worse off within the low-income population, because our goal is to just reduce the rate. The same argument can apply to other impact measures. I talked about nonprofit organizations helping homeless individuals. They can choose to address basic needs of many of these individuals, like temporary needs, or they can invest the same amount of resources to help only a few of those individuals become self-sufficient through job trainings and rehabilitations, more advanced kind of programs. So which one is a better approach? It's not easy to answer. So we need really collaborations between government agencies and academics to address these critical issues, which is both operational as well as public policy issues, to kind of streamline and standardize the way that we look at and we measure impact for such organizations. And it doesn't have to be the same for all organizations, but as it stands now, there is a misalignment. And in many cases, I can say there is no measure for these organizations to even use, and they have to come up with their own measures. So I think working in that directions could be really impactful for the future of improving homelessness and poverty.
Thank you for that, Dr. Rahmani. And I think what you've helped to point out is that as Congress, in this case, sets policy and serves in its oversight capacity, there are asymmetrical ways to think about these questions that may or may not be being brought to the forefront. And I guess to that end, do you see the federal government using data science, I'll say at scale, to create solutions for disadvantaged communities? Dr. Rahmani?
Absolutely. I think there are many opportunities. Just to give you an example, the release of footfall data, or it's called mobility data, by census block groups, which was released by SafeGraph and Advent for all the states within the US, has led to several impactful research studies with important findings. These studies not only show the extent of the issue of homelessness across the United States, but they can also guide the government on deciding where to open new shelters to better match supply and demand. I think there is an opportunity to conduct many more of such studies by utilizing data from homeless shelters, which, by the way, doesn't exist. Like, there is no kind of a clean data available. Social security, disability services in different regions to understand the extent of this issue and come up with solutions. And the government can definitely play a critical role in making such data sets available to researchers, and also by promoting such research projects through funding and sponsoring academic research.
Thank you.
Dr. Johnson, do you want to add to that?
Yeah, thanks. I agree very much with Margaret. Here's another example. The U.S. Department of Housing and Urban Development has recently announced a rule called Affirmatively Furthering Fair Housing, in which programs funded by HUD must take meaningful actions to overcome patterns of segregation, promote fair housing choice, eliminate disparities and opportunities, and foster inclusive communities free from discrimination. HUD has developed an Affirmatively Furthering Fair Housing data and mapping tool. With this tool, users can select jurisdictions and create a wide variety of maps showing social indicators associated with fair housing, such as labor markets, transit usage, environmental health, and disability. These maps can help identify areas in which new housing may provide social and economic opportunity, as well as housing integration.
Thank you. You both have provided a lot of information. So let me try to bring this all together with a wrap-up question. How can the government really utilize and leverage the work that you both and your colleagues are doing to truly create more impact for disadvantaged communities? Dr. Johnson, we'll start with you.
Sure. I would like federal, state, and local governments to use analytic methods to develop programs and initiatives that support equity and social justice across different policy domains. These methods could improve understanding of barriers to equal access to decent housing, transportation, education, and nutrition across communities of color and low and moderate income communities. These methods could help compute what is lost in terms of economic growth and social equity due to systemic barriers to social and economic justice. And these methods could help identify stakeholder-driven solutions that can make all of us better off and which recognize that problems affecting disadvantaged communities are interconnected and affect us all. For affordable housing, for example, government could use data from the Affirmatively Furthering Fair Housing data and mapping tool that I mentioned just now to generate plans for housing investments that are strategically targeted, that reflect the needs of multiple stakeholders, that further the cause of social and racial justice and integration, and which are economically efficient. For climate change, government could develop responses targeted at disadvantaged communities that address extreme heat, vulnerability to extreme weather events, and sea level rise in conjunction with related issues of housing insecurity, lack of affordable and accessible transit infrastructure, and health and social infrastructure that is prone to fail in the face of emergencies such as the COVID-19 pandemic. In other words, recognizing that many social problems are interconnected.
Thank you. Dr. Rahmani.
I completely agree with Michael's points. I think it is really, really important for the government to utilize analytic methods into governmental decisions for addressing these issues. Just to add to what Michael said, and just to be a little bit more specific, I can talk about the study that we did with these organizations who are helping homeless individuals. Some of the findings from that study that could be really, I think, could be useful for the government to consider. Besides the issue with the impact measure, which is seem to be very ad hoc at this time, and definitely there are rooms for improvement. Some of the other suggestions that we can have is about how government can improve allocation of funds. It is important to allow and encourage these organizations to spend funds on administration and technology. While earmarked funds are better than no funds, and it's always appreciated, they limit an organization's ability to improve their efficiency through better technology and administrative resources. These organizations lack clean data sets because obviously they don't have the technology and they cannot hire experts. And that has limited them from understanding the state of their services and making impactful adjustments. I see so many opportunities in that domain to basically help these organizations work more efficiently. On top of that, we have realized that oftentimes there is a mismatch between the services that individuals receive and their true needs. And setting policies and incentives, so what government can do, setting policies and incentives for reducing such mismatches can be really impactful, because it not only helps those individuals to get to the state of self-sufficiency faster and more efficiently, it will also open up capacity at those organizations and allow them to serve more people in general, because they don't have to go back and forth with the client to find out what their true needs are. So these are just a few examples that I think at least our study so far, one of the research projects that I talked about basically generated, but obviously there are so many studies that have been done in this domain and related domains that I believe policymakers can benefit from that. Overall, I think the government can play a key role in helping any of those organizations who are trying to help people who are suffering from homelessness or poverty just operate more effectively and efficiently. So that's my main message.
Thank you for that. And thank you both for not just an interesting conversation, but an important conversation on super consequential issues facing every corner of the country. And Dr. Rahmani, You closed with some of my words unintentionally. For our audience, operations research, analytics, data science can help the government create more efficient and more effective outcomes, not just as it relates to this issue around disadvantaged communities, but issues of consequence across a whole broad range of areas. And if you're interested in learning more about today's conversation and those topics, or if your office is interested in other policy areas, please feel free to reach out to me at jeff.cohen@informs.org, and I can connect you with subject matter experts from around the country to talk through a variety of public policy issues from an operations research, analytics, and data science type of perspective. We thank you for taking the time to join us. Dr. Johnson, Dr. Amani, thank you both for your time. And to our friends on Capitol Hill and beyond, we look forward to seeing you soon.